Thank you, ladies and gentlemen, for coming to listen to Hangama. Firoz said about Hangama being about hunger. It's actually about hunger and malnutrition and the way we can eradicate in this country. This is the logo of the report that we want to publish. It's all about the story of bread and butter for many, and the story actually of not having bread and butter for many, particularly kids in the range of 0 to 5, and most importantly, their mothers. This is a journey that we thought we should do, which is about going to the hinterland of India, ideally trying to go to every part of the country and see if we can figure out where are the country's most malnourished children living. We've been disturbed for the last 20 years by the data which says that almost 1 out of 2 children in the age 0 to 5 are in some form or the other malnourished. And we were worried, how do we change this? This started as a discussion with a small group of parliamentarians across the political parties, as Firoz just mentioned. But we then decided that the single most challenge that we have is that we probably don't know on a real-time basis, where are these children? Where are these mothers? And if we have a targeted intervention to get them out of this problem, do we really know where they are? The National Family Health Survey 3, which was the last survey done in this scale, has a data which is almost 10 years old. I sort of shudder to think and tell you that those children who have been tagged or identified probably won't be living at this juncture if you want to do something. So this was a quest to see if we can collect real-time data from some of the farthest places in India where sometimes no form of communication actually exists. 112 districts were selected for doing this, 100 of them which figured in some of the most depressing data as far as child's indices were concerned. They were predominantly in 6 big states. We also picked up 12 districts which ranked on the top of the list as far as children's health were concerned. And we thought maybe those 12 districts will have something to offer for us. Roughly 84,000 rural households were covered. 1.5 million person hours is that took us to collect the data. I should sort of quickly jump here and say that it wasn't actually collecting data as in filling in a questionnaire. It was primarily about listening to people, particularly mothers. And that's what we did. Listen to mothers, 100,000 of them. But more importantly, we also did actually figuring out the weight, height, details as required to qualify a child as malnourished or not, severely malnourished or moderately malnourished, and see if we can figure out is there a correlation between this malnourishment data that we get and some of the background of the mothers, or more importantly, do these mothers have something to tell us which we as a nation have missed? So in a classic sense, we did the counterintuitive thing, which was not just look at data first and then look at information out of it and knowledge from that. We just did the reverse. We felt knowledge is out there with the mothers. Let's go down, listen to them, ask them so many things that nobody ever asked them. The challenge was to make them talk honestly, talk with trust, and see from that knowledge, can we distill some information? And from that information, can we throw you the data, which is about the malnourished children in various places, and would that data sort of resonate something that the mother said, and thereby help us design program for this nation in a manner that actually helps all of them on a real-time basis. So this was a journey of going the other way around to collect data. And I'm going to share with you some of the highlights that humbled us, some of the highlights that sort of are extremely insightful that I can't wait till the report is ready to be shared. So the process involves fundamentally going to villages. This has been a predominantly rural survey. Going to the villages and identifying elders and opinion makers, getting their consensus that we want to do something like this. Sometimes they are local government functionaries. More often, they are the actual opinion makers of the village. Get their legitimate approval to say that we want to do something like this, get them on board, and then see that we map the village in a scientific manner into different segments which will allow us to do the random sampling properly. This is one such exercise being done in one of the villages where we involve the locals, educate them on what's happening, what's going to happen, and start getting the sound bites on the whole problem of malnutrition. This then gets transferred into a paper where we get to then block-wise number the houses that we need to go and survey. Specifically, as I said, it involves weighing a child's, measuring the height, two key indices that we look at. And we also thought, given that it's useful to get some kind of a litmus test approach also checked and validated, which is in this case called in the nutrition space the mid-upper arm circumference, which is typically very useful in an emergency situation. When you want to really have a distress solution, you don't have to go through the height weight. This is reasonably accepted and calibrated world over. So we're trying to use this in one more sense to validate the fact that this works. So we're looking at that as well and checking on stuff like very obvious ones which can be later told on, which is to see if there is edema in the legs, feet of the children, and the main challenge of hangama, which was to make mothers talk. This was extremely challenging. Most of them have never spoken on issues which range from the broad spectrum of safe motherhood practices to challenges they face being a woman, challenges they face as a mother, to what it means to actually bring up a child. And it's not that we ask them these set of questions in a manner that is to say an yes or no. It's to tell them, to make them speak about their lives. It's to make them talk about what was it that they knew very, very much as something that they thought was their world's issues, and how we could offer them to open that up for us to convert it into information. I should say that in some of the places that I've been personally involved, it's been the most heartrending experience. The way, despite all the problems, they're full of joy, full of solutions, and have offered some of the most insightful ideas for us to see how this can be implemented at a macro level. Well, we leave with this sticker which says that the survey has been done, house is sort of tagged for any revalidation if it's needed. And as I speak now, the data is being tabulated and the analysis is being looked into. But let me throw 4 of the key learnings that we had from this survey. The fundamental and the most shocking one, to me at least, was that we haven't met any of the cases where we felt predominantly that mothers knew what malnutrition is all about. In a classic Hindi sense, the word kuposhan, when we ask, they say they don't understand it. It's not about the literal meaning of it. We try to explain what a malnourished child could mean or look like or is, and they haven't a clue. The lack of awareness about how a malnourished child would look was something that we weren't really prepared for. There were classic responses like, she is talking, she's playing, she's eating, she's sleeping, and she doesn't have fever. So why would you say she's sick? Because there was only a healthy child, a sick child. There was only a fat child or a thin child. There was never a malnourished child. So what is malnutrition and what is this kuposhan? I mean, we tried breaking it down into various iconography that we could think of, but it just doesn't get there. So I think we need to tell everybody in this country that we have to think of the smartest ways of communicating to them. We have to tell them, we have to really, this is a communication challenge at best. We need to tell the people of this country that when we plan a policy, whether it's an NGO, whether it's a foundation, or most importantly the government, how do we communicate so that women, mothers know it? Because let me tell you, it is reaffirmed for the 1,000th time in my mind that if a mother comes to know, she will go to any extent to save the child from malnutrition. The fundamental block, she just doesn't know. The second challenge, and this has been based on a lot of education we got before our journey, the whole challenge of figuring out whether the first milk of the mother is actually given to the child, what is called as colostrum. What amazed us was to know that the colostrum had such a huge cultural, firewall set into it. If you ask any of them, it was very clear that the colostrum was often decided by a priest in some temple, or it has to be given by the grandfather of the family, who probably is not there at the time of delivery. There are so many reasons that come up as to why, despite knowing that it is important, they may not be able to give the colostrum on time. So how would we crack if this nutritional component has to be actually given to the child? How do we ensure that this can be removed. We got an enormous amount of insights into how to work around these cultural roadblocks, and that's going to be part of the report finding. This is yet a classic village, and I sort of challenged myself to say spot the child, because there is cattle, there is enough fodder and everything. So what is the challenge in a house like this? I mean, to start with, for us, it was to spot the child. She was right in the middle of the haystack, and this was the grandmother looking after the child. And this is where we realized the next biggest learning. And I go back to early days in corporate world where, one of the early dictums that we were told was, leave is a privilege, it's not a right. And this privilege is enjoyed by almost all the mothers in organized sector in India. The privilege of getting maternity benefits, maternity leave. For the women in the unorganized sector who have to actually go to work the second day of delivery to fend for themselves, there isn't a privilege. And we feel the whole motherhood in this country that we met in whichever form have been very silently clamoring for this becoming a right for theirs. They're saying you can talk about colostrum feeding, you can talk about exclusive breastfeeding, but we are out into the field third day after delivery, second day after delivery. Can we dovetail the famous employment scheme in this country at the moment, which is equivalent to what is called as the right to work, the National Rural Employment Guarantee Assurance? Can that be dovetailed to give every mother a 6-month equivalent of wages so that she doesn't have to actually go out and work? Were some of the ideas that came up when we started talking to them. This is an Anganwadi in Jharkhand. Anganwadi, a creche where kids between the age 2 to 5 are typically fed and initiated into early childhood learning and development. We found that the most heartening thing about this Anganwadi program, the ICDS program, probably the world's largest feeding program of its kind, is the fact that these are pockets where children are actually liberated from hunger. We saw whenever the food is served across the Anganwadis visited, kids of all kinds land up there and have a hearty meal. I mean, you can see them. I mean, we have so many pictures of these kinds of Anganwadis. It's a place where you feel for, if not for anything, just for this liberation from hunger, for independence from hunger, these Anganwadis have to continue as beacons of hope for these children. But to me, the challenge that speaking to Anganwadi workers, staying in the Anganwadi and observing the happenings in that place for at least 2 to 3 hours every time we went, the biggest idea that came out, which is what we want to tout and we want to go to town and request everyone to consider, is the whole idea of how do we get real-time data out? Can we use cloud computing here? Can we say that an Anganwadi worker not just weighs a child, measures the height, and then after a few days feeds it into some laborious ledger which goes to a district after a month or so and probably is never looked into or given back as a feedback on what to do with the child? Can that whole archaic system go away? Can we look at a gizmo where a child can stand, the weight is taken, and you press the button and it goes into the cloud where it's computed and an analysis is made up of, and the data is fed into a system by which you know exactly real time what's the situation there. This is useful for targeted interventions. This is useful for real time monitoring, and this just brings technology at a level which can be used by everybody in the most required conditions at this moment. So these hungry kids allowed us to think, brainstorm, and make us go hungry for the whole idea of getting cloud computing to this level. I mean, the easiest one, which was not a surprise, was to say that almost all habitations didn't have potable water, and that children 0 to 5 years of various kinds were fed with unclean water. We found that sanitation practices were also almost nil in many of the places that figured in the 100 districts particularly. And we therefore want to see very strongly, is there a correlation between the 12 districts where these seem to exist? Can we say that there is a correlation, that if potable water is available, can we empirically demonstrate it and say this is something we need to address if we want to solve the complex issue of malnutrition? So and on the space of hygiene on water and sanitation, I should confess personally this was a big surprise. The fact that soap a cake of soap, I found it was a masculine thing. It even had a gender to it. Across the villages that we went, women were often not using soap at all. It was meant to be a status symbol for men who would use it because it's fragrance and it is something that they can use because they will go out to work and they would smell good. For women, it was almost a luxury good. And we found that cakes of soap were not used even if it was available in the house and at an affordable rate on a daily basis as a habit. We found women actually confess that even after going through their daily ablutions of all kinds, they just don't touch the soap even before taking their children. And it was almost like a strange question that, why would we connect these two to be there? So the whole idea of hygiene was, upside down for us when we started probing further into their normal lives. I think there are a couple of other interesting data that we are trying to correlate. One, is there a correlation between schooling, the age of school, or the time the mothers dropped out of school or completed schooling with malnutrition data in that region? Is that something to look at, and can the survey say again sort of empirically that there is a correlation which we need to worry about or think about? Similarly, look at the fact that is age at marriage crucial? Let me confess that almost everywhere it was clear that especially in the 100 districts, 16, 17, 15 were relatively normal ages that we found girls were married. It had to come out through questioning, through probing. None of them knew their date of birth, none of them knew the date at which they married, but then you could figure it out over a period of time, and we had to work out on certain events and calendars. And the message was, this wasn't so in the top 12 districts. I think this particular slide is from Himachal Pradesh. As you see, the MUAC says that it's in a green level, the child is healthy, and the mother was educated, and the age at marriage was different. So there are these data that are going to come up where the correlation will show us, interesting further reinforced arguments. Two other elements which came as a surprise, and therefore we want to look at, is the whole point about birth sequencing. Put it very simply, the fact that if there is a family or a mother who has 4 children, and the first and the fourth, is there a difference in the status of malnourishment? Was the first child worse off or the fourth child worse off? Can we find out correlation to see has sequencing anything to do with it? Same way, the whole problem of spacing. If there is space between 2 children, is there a correlation with the malnourishment in terms of data? These are some of the stuff that we're looking at to come out of comparison of data that will come because we asked mothers such probing questions on a cascading manner leading one to the other. Yet another issue that we felt strongly is that we've looked at the infant feeding practices, what is classically known as infant and young children nutrition practices. And there is a plethora of surprises, there is a plethora of assumptions that we had which looked to be completely wrong. So we want to correlate and see, are they leading to anything that is specifically a strong delta factor in breaking the malnutrition jinx. So that's one thing that we're looking at very closely. Lastly, all I want to say is that this has been an extremely humbling experience. We just want to say that the work that we've completed, the data that will come out and the report that will be out will primarily be a salute to mothers of this country. Ma tujhe salam. Thank you, ladies and gentlemen.